This video is for basic facial, and we're going to start the video as if I've just arrived to work. So the first thing that I always do when I get to work is wash my hands. So I would wet my hands underneath the sink, get a coin-sized amount of liquid hand soap, wash my hands together down to the wrist, wash the back of my hands down to the wrist, wash my fingers, and of course the backs of my fingers. I would wash my fingertips and nails, between my fingers and my thumbs. I'd wash my thumbs, and I would wash my wrists. I would do all of that interlocking wash, of course, for a good 20 to 30 second minimum, and then I would rinse them underneath the water. Really good proper rinse here. And when I feel like they're thoroughly rinsed, I would grab some disposable paper towels or a clean towel, turn the faucet off, dry my hands off with the paper towels, throw it in the trash, and then if it was a dirty towel now, it would go in a closed container until time for laundry. When that's finished, I would grab my hand sanitizer, 70% ethyl alcohol, and sanitize my hands. And then I would need to prepare my room for the basic facial for my client. So let's just review what that entails. So I would need to disinfect my workstation, my bed, and equipment. Of course, I'm doing all of these things before my appointment arrives. I want to save as much time as I can because obviously I have a full day, a full schedule, but I want to be very conscientious of their time as well as mine. And so anything I can do ahead of time, I'm going to do. So I'm going to disinfect my workstation, bed, and equipment using a disinfectant wipe, of course, following manufacturer's instructions. I'm going to check equipment to ensure that all devices are in safe working order and plugged into a working receptacle. I will gather clean supplies needed for the facial service, stored in a clean closed container. I'll turn on a hot cabbie and stock it with at least 3 clean wet towels. More may be needed depending on the service and the client's needs. I'll fill a clean steamer glass with distilled water and preheat the steamer. I'll dispense products needed for the service according to skin type and client's needs as follows. I will prepare disposable portion cup tray for each product with a portion of the product by opening the top of the container and ensuring the tip of the nozzle does not come into contact with the disposable portion cup tray, or remove the product with a disinfected or clean single-use spatula, close the lid to the product, and set the portion cup tray on the tray. I'll drape the facial bed using 1 fitted sheet, 1 flat sheet, and 3 towels. Place clean laundered sheets down on the disinfected facial bed, placing a towel horizontally at the head of the bed. Lay a hairnet and headband on top of the first towel, along with a roll towel to support the head and neck of the client. Save the third towel to lay across the client's décolleté. So I'm going to show you the tray I prepared, and then we'll do our client consultation. So on my tray right now, I already have cotton rounds, water, makeup remover, astringent, 4 squares. I've got some wooden stick Q-tips, some of these spatulas that are disposable that you can scoop product out with, toner, disposable gloves for extractions. I've got cleanser, exfoliant, massage, mask, eye cream, and moisturizer, and I have my little fan brush to apply my mask. So I have everything that I need for the client to perform the facial service. Now, obviously, if it was someone I'd never met before, or I would need to get to know to figure out skin type and all that, I could wait to maybe fill some of my, dispense some of those products, but I certainly would be set up and ready to go with everything that I possibly could be ahead of time, like I said, to be very mindful of everyone's time. And then I would meet and greet with my client and do a client consult. So let's talk about that. Always approaching the client every time with clean hands. So my hands are washed. Of course, I'm going to wash them again before I start the service. We'll talk about that. But just so you know, when I go and meet my client to discuss the service and their specifics, my hands are clean. So I greet my client and I escort them to the work area, and I determine the client's preferences. I assess the client's needs. I assess the client's skin by performing a skin analysis. That's with my eyes at this point, to ensure that there is no inflamed, infected, broken, raised, or swollen skin in the area to be worked on, or an open wound or sore in the area to be worked on, infection or infestation such as lice, to prevent from safely performing the service. I will assess the client's consultation form for any medications and products they've used within the last 72 hours. I will also consult on any known allergies. I will consult with the client on any facial surgeries within the last 3 months, and if the client's under a physician's care. I'll assess if the client is prone to cold sores or fever blisters. I'll assess if the client has used exfoliating or lightening agents within the last 72 hours, like alpha hydroxy acids, beta hydroxy acids, hydroquinone, etc. I will assess facial injections within the last 3 weeks, like Botox or hyaluronic fillers. And if the client is free from any of those contraindications, you can move forward with the process. And my client is. But that part is really, really, really important because you need to make sure that you're not going to do anything harmful to your client or your client's skin. You need to find out exactly what they're taking, what their health history is. All of those things will affect the skin. So we have to find out and make for certain that we know everything that we need to know before we perform any kind of service on a client. And the client consultation form is our way of doing that. And then you can ask those open-ended questions where they can give you more details if you feel like you need to get more details, or do a little research as well. So taking the time there is critical. And so now I want to get my client comfortable before I start the service, before I wash my hands to start the service. So you would give them privacy to change and put on the drape, because they're going to be, they won't have any clothing from the chest up. And so you'll let them go into the facial room, have that private, quiet time, get in the bed, and then you'll come and knock and make sure it's okay if you come in. And she's already in the bed, as she would be, and she's got the blanket on. She's on that horizontal towel. And then what I'm going to do is I'm going to give her that extra comfort. So I've got the rolled towel here for her neck. And I have a hairnet to keep her hair out of her face. And I've got that extra towel that I'm going to lay on her décolleté here, just give her that little extra coverage. And then I will be washing my hands. So what I'm going to do is go to the sink and wet my hands and get that coin-sized amount of liquid hand soap, wash my hands to my wrists, and wash the back of my hands to my wrists. I would wash my fingers, of course, and the backs of my fingers. I would wash between my fingers and my thumbs. I would wash my fingertips and nails. I would wash my thumbs. And I would wash my wrists. I will do all of that wash for a good 20 to 30 seconds. And then I would give it a thorough and proper rinse underneath the water. And when I feel like everything's rinsed properly, I'll grab either a clean towel or disposable paper towels to turn off the faucet with. If it's paper towels, I'm going to dry everything off. My hands, I mean. If it's paper towels, it's going to go in the trash. If it's now a dirty towel, it would go in a closed container until time for laundry. And then the last step to that hand wash is getting our hand sanitizer, 70% ethyl alcohol. Sanitizing up. And once we feel like we're good and sanitized, we are ready to start the service. So the first thing that I'm going to do for my client, of course, is remove any makeup that she might have on. And everyone's different. Some clients may have on more, some clients may have on less or none. So just, use your judgment. And if you need a little bit more time or need to do a little bit more to get it off, you definitely want to get all the makeup off. And I'm just going to dry everything off. And then what I'm going to do first actually is her first cleanse, and then we'll do a skin analysis. So let's do our cleanse. Cleanse number 1. And then you want to remove that cleanse. Oops. And it's at this point that you'd be performing that skin analysis. So we would want to protect our client's eyes. So what we're going to do is cover up our client's eyes. And then we would be bringing over a magnifying lamp or Woods lamp and turning it on, which is very bright. So that's why we're protecting the eyes. And then we're going to do, looking through that magnifying lamp or light, this is where we're going to do our skin analysis. And maybe you and your client talked about specific things that you're looking for straight away. Like maybe she's worried about fine lines and wrinkles, or maybe she's worried about clogged pores and a lot of like pustules. You have to look and see. so you may have a target. She may also have not given you any targets, which you're going to look for anything, any and everything anyway. You're looking for dehydration. You're looking for hyperpigmentation. You're looking for basic knowledge of her skin as it is. Number one, for ways that you're going to treat it today, things that you're going to do during this service that make it more beautiful. But you're also going to be thinking about things that you could encourage her to use at home in her daily life, in her daily morning and evening routine, to make her maximize the benefits of this treatment and just skin in general, because she's with you 30 days. She's with you one day out of the month. Maybe she's with herself every other day. So she's going to have a bigger impact by what she does every day than what she's going to do in a single service. And you're just educating her on that. The other thing is that you are her skin care specialist, and maybe you notice something that she doesn't notice. So you're going to want to make a mental note and then record it either in, if you have a client profile card, or if you do like a software system, you're definitely going to want to make sure that you're looking at that and addressing that, so that if there's any change, like maybe in a freckle or a mole or something, that you're the person that you're going to always have that notated on the chart. Or maybe she's coming in for repeated services and you already know that, so you're going to document things that are happening every single time. So you'll always have that as a point of reference. And certainly if she leaves here, she can contact you in a few days, or you're doing your follow-up, you're going to be able to discuss things. So that's great. Take the time here to really look at everything that you're trying to, not only for this service, but going forward. And so it's not a rush deal. And then when you're done, you turn the light off and you can move everything out of the way. So we're going to remove her eye pads. And now we're going to do cleanse number 2. And we're going to remove cleanse number 2. And now we're going to go in for our third and final cleanse, number 3. So make sure if everything is not off now, it's not going to get off. So and once you finish your cleansing, you'll tone. So I'm going to get my cotton rounds, I'm going to get my toner, and just know that my sprayer will not touch the cotton rounds. So we're just keeping that little distance there to keep it sanitary. So I won't press it up against that. And now that she's cleansed and toned, it's time to exfoliate. So I'm going to apply some exfoliator to her face and neck. And I'm just going to spread it out first because I'm going to be massaging it in. You're always going to avoid the eyes, the nose, and the mouth. And of course, we are going to be following manufacturer's directions. But so it's going to be for about 1 to 2 minutes as far as massage goes. But I just want you to know that I was just applying it and kind of spreading it out there quickly for a reason. And the reason was that I was just going to be actually massaging it in shortly for 1 to 2 minutes, like following those manufacturer's instructions. And anytime we do anything, cleanser, it doesn't matter what it is, we are always avoiding the eyes, the nose, and the mouth. Just saying that, but that's what we always do that. And once you've got that massaged in, I'm going to review what, what is going to happen now. Let me just get a sip of water. I've just been struggling today with allergies, and so I'm trying to stay better hydrated so I won't get a tickly throat. Okay. So you've applied and massaged in that exfoliant. So what you would do now is retrieve the steamer and turn it to the on position. And position the steamer next to the facial bed, making sure that it's facing away from the client's face. And as the water heats up and emits an even outflow of mist. Once the steamer is emitting a mist, position the steamer 16 inches over the client's face and aim it at the client's chin for even distribution on the face, allowing the unit to function for 3 to 5 minutes. Remove the steamer from the client's face, return the steamer to its previous location for disinfection. So what we're going to do is, of course, bring the steamer over to the facial bed and make sure it's not facing the client in any way when you turn it on. So that way it takes a minute, it gets itself going, and it's got the nice even flow of mist. You're going to turn that part around about 16 inches away from the client's chin, and then that mist will just flow up and over the face while the exfoliation product is on. And we'll do that for 3 to 5 minutes. Of course, we don't have the steamer, and it's a video, so we're not going to be here for 3 to 5 minutes. We're going to move forward, but that's what would happen. And then after that 5 minutes has elapsed, you're going to turn the steaming part away from the client, push it back to where you got it from, turn it off. So it's not in your way, not in the client's way. And then you can remove the exfoliant. I also do not have a hot cabbie for my towels, so I am going to pretend like I do. I'm going to get my towel right here, a nice little steam towel, nice wet towel, and I would get it out and I would shake it out because it's hot, and I would test it on my wrist to test that temperature. And then once I feel good about it, I would test it on my client's collarbone, make sure she feels good about it as well, which she does. So I do that nice little fold, and then I'm going to apply my hot towel to the client's face. I'm going to cover up the face and the eyes, but keep the nose out so that she can breathe. and then I'll just apply some light pressure. And so you don't have a lot of time with your hot towel, maybe 20 to 30 seconds before you start to feel it cool off. So you're just basically letting it warmer, feel nice and warm on the skin, and open the pores, continue, because they've already had that nice steam on there. You could also do what the steamer does, actually, with repeating hot towels over and over for 5 minutes, if you didn't have the steamer. You just have to have that hot towel cabbie, and you could keep pulling them out as they cool down, and you would do that for 5 minutes, and then that would do the same thing as what that steamer does. So like the 3 to 5 minute time frame, you know, the same. You're just using hot towels versus the steamer. And then you want to get your hands really dry because the next step is extraction. So you have to put on disposable gloves for that, and it's difficult to do with wet hands. And of course, you would take a minute here to figure out where and what, which you've already kind of done. You can also bring in the magnifying lamp if you want to do that to do your extraction. So I'm going to cover her eyes back up and pretend like we're bringing that magnifying lamp over and turning it on. I'm going to use those wooden stick Q-tips soaked in astringent, which means every time I use one set, like I do an extraction, it goes in the trash. You never reuse it for another extraction. You could use cotton rounds soaked in astringent, and then you would just work it around your fingers, you know, move it, and then so you could do more than one extraction with that and then throw it away. That's just an option, just so you know. I'm going to use the Q-tips. So thankfully, my client's issue was not a lot of extraction that was needed. So I'm going to do it. She was concerned about it, but once we got in there, no. And she just had a little congestion with wearing the masks all the time like we have to do now, which once I did the little exfoliating, the physical one, the scrub that we just did and then removed, it got a lot of it out, so I don't have to do a lot of other extractions. One more. And she's got one on her chin I need to get. So every time I'm just going back over here, getting 2 new ones soaked in astringent and throwing them away. So I can turn my light off, take it out of the way, remove the cotton rounds, and then throw my gloves away. And we will now tone. So we have exfoliated, extracted, and now we're going to finish that process with toner. And once again, I'm going to get cotton rounds, and I'm going to keep them about 1 inch away from the sprayer, just that we don't want the nozzle touching the cotton rounds. And the really great thing about getting past extraction, and by the way, you never want to do that for more than 5 to 7 minutes because it can be painful and you don't want your clients to be in pain for a long period of time, is massage follows that. So you tone and then you get to do massage. And the thing that is most important, I think, about the massage step is that when you're getting ready to do your massage, you make sure you get enough of your massage product on your hands to apply to your client before you start your massage. That way you do not take your hands away from your client once you start the massage. So I'm just taking a minute here to spread out my massage product on the areas of the face, neck, and chest that I'm going to be massaging, so that when I work through those areas, then I know the product is there. I have plenty of product, and I won't have to leave her face or neck with my hands while I'm performing that massage. So she can truly have a relaxing experience, especially after, let's say, not the most pleasant when you have to get extractions done for anyone. And imagine if it's someone that has to get more than less, although with acne or severe acne, you cannot massage that much. So because it's bacteria and you could just make it worse. So that's something to note as well. If you're dealing with someone with a lot of acne, they're not going to get a big massage. Maybe while they have their mask on, you get to massage their arms or shoulders or something like that. It's a nice thought versus a big face massage. And then you're going to remove that massage product. And once you have removed your massage product, you will be applying your mask. And I'm going to use a brush to apply my mask. And like everything else, we're avoiding the eyes, the nose, the mouth. And you would always follow manufacturer's directions for any of this mask also as far as timeline goes, but we'll say that it'll stay on anywhere from 5 to 10 minutes. So you would normally be waiting that timeline and maybe do like an arm massage or something during that time. But because we're doing a video, we're going to go ahead and pretend like that time has elapsed. So whatever this was supposed to sit on here for a 5 to 10 minute range, it's done that. So we're going to remove our mask. will follow a toner. And once you've done your toner, it's time to apply her skincare. So I'm going to be applying eye cream and then moisturizer, and I'm going to be using a moisturizer with SPF for day. I'm using my ring finger to apply the eye cream. I'm going to go on the brow bone and the zygomatic arch. Just a nice little light tapping. Moisturizer I'm going to apply everywhere because it's SPF, but all over the face, on the neck, and a little bit on the décolleté. We've already discussed the importance of sunscreen. She knows it. That's something she's definitely going to be going home with today. She's also going to have her aftercare kit, and we're going to go over a few other things that I think would be important. She's already booked several appointments because we're working on something specific. So the appointments are booked. We just got to make sure she's doing her product part at home. I think I'm going to finish with last a little bit of a lip balm. We want those lips nice and hydrated, of course. And so now we would give her privacy to change back into her regular clothes and meet us out at the client waiting area. And we would then go through any aftercare and maintenance that we haven't already discussed, that we're just reviewing with her what she needs to be doing when she leaves. And then we'll get her checked out because we know she's already booked for several other appointments. And then we need to get back to our room because we have another client coming. We have to clean and disinfect. So we're going to throw away any single-use items that have not been thrown away already that we might have used. We're going to place any implements that we use that are now dirty in a closed container labeled to be disinfected. We're going to take all of the linens from the facial bed, towels, etc., drape, and we're going to put them in that closed laundry container until it's time to do the laundry, and then we will identify a proper cleaning agent, read manufacturer's directions, follow manufacturer's directions for mixing and usage, wipe down the workstation and area with cleaning solution to remove debris. We're going to identify a disinfectant that is bactericidal, virucidal, fungicidal, and EPA approved for use in a salon setting, which means that you need to get another pair of disposable gloves to put them on because you're going to need to wear them to use this product. Follow manufacturer's directions for mixing and or using appropriate aerosol disinfectant. Disinfect electrical equipment, store it in a clean area separate from other implements. Then you can remove your disposable gloves and trash them because it's time to wash your hands. So we're going to wet our hands at the sink. We're going to get that coin size liquid hand soap, and we're going to wash our hands down to our wrists. We're going to wash the back of our hands down to our wrists. We're going to wash our fingers and the backs of our fingers. We're going to wash our fingertips and our nails. We are going to wash between our fingers and our thumbs. We're going to wash our thumbs, and we're going to wash our wrists. We're going to do all of that for a minimum of 20 to 30 seconds. And then we're going to give everything a thorough and proper rinse underneath the sink. Once we feel like it's thoroughly done, you're going to grab disposable paper towels or a towel, a clean towel, and turn the faucet off. Dry your hands off completely with the towels or paper towels. If it's paper towels, it goes in the trash. If it's a dirty towel now, it's going to go in with the rest of that laundry with the lid on it until it's time to do the laundry. And to finish your hand wash, you're going to grab 70%. ethyl alcohol hand sanitizer, and you're going to sanitize those hands. Only then, when they're sanitized, are you done and ready to set up for your next appointment that's coming in, which is also a basic facial. So you've got to look at all of that and get your room ready to go. So this concludes basic facial video.